Video, we'd like to talk about adenomyosis and the proper treatment for this condition, and also why patients should avoid hysterectomy. So adenomyosis is another common gynecological condition amongst women in their late 20s, 30s and also 40s. Adenomyosis is an incredibly torturous condition because of how it can cause some of the most extreme menstrual cramp, menses pains whenever your cycle, your day of the month has arrived. During that period, most patients report agonizing pain, so much until that they are unable to function normally, unable to carry out normal daily tasks. They can't even go to work. This is how severe it is. And furthermore, there are many patients that are not aware of a proper treatment out there that is available, that is also not hysterectomy, and they choose to live with this adenomyosis for years upon years, living with this suffering. They think that it's normal. For years upon years, developing some complications where they are unable to get pregnant anymore, or if they do get pregnant, they are experiencing recurrent miscarriage. So if you do have adenomyosis, or if you have any of the symptoms, which is the extreme menses pain, and then also the missed periods, and also abnormal bleeding between menstrual periods, it could be adenomyosis. So please do get diagnosed, because there is treatment available, and the sooner you get it, the more effective the treatment outcome is, and it's better for you during your pregnancy journey, where you will not see any pregnancy failures and also infertility. So in mainstream treatment for this adenomyosis in the United States, in Europe, most doctors will straight away recommend you go for hysterectomy. Hysterectomy, although is considered an intervention, but the treatment is that they remove the entire uterus or parts of it to the point where you are unable to get pregnant anymore. It results in absolute infertility, and we believe that hysterectomy is simply not the most effective treatment. Furthermore, it's not only not effective, it's extremely invasive, destructive and unnecessary. At Antai Hospital, we offer you a treatment where you get to keep your uterus, but you get your adenomyosis treated where there are no symptoms anymore, and you can go on to have a normal daily life, a higher quality life, where there is no more menses pains, and you can achieve all your pregnancy goals naturally and healthily. Our doctors here, we will conduct a highly effective, highly specialized laparoscopic surgery where we will pinpoint all of these adenomyomas present within the uterus walls. These adenomyomas are deeply rooted inside the muscle walls of the uterus. So this surgery does require a surgeon that has experience and also high level of technical skill. However, once we do this surgery for our patients, which has a success rate of up to 95%, our patients not only get to keep their uterus, where most doctors recommend you go for hysterectomy. At Antai Hospital, we do not go for that approach. We simply remove the underlying root cause, and you can see that you are able to achieve your pregnancy goals, and also see that these symptoms are already slowly dissipating away within a week or two. Once you are fully recovered, you will notice that your quality of life has increased significantly, and during your menstrual cycles, you won't be anticipating in fear and also in trauma anymore. So at Antai Hospital, we do not recommend hysterectomy for benign treatable conditions such as adenomyosis. If your doctor does recommend you go for hysterectomy, especially for benign conditions like adenomyosis, please seek a second opinion. And also, if you are interested, you can receive this treatment here at Antai Hospital, where we don't remove your uterus. Hysterectomy not only is destructive, it can bring several unnecessary and also lifelong side effects. First of all, not only are you absolutely infertility, which means you can only achieve pregnancy via surrogacy or adoption. Not only can it cause urinary incontinence, it can also cause some problems with pass motion. It can also cause pelvic prolapse, where the entire pelvic organs start to move downwards. It can also cause some swelling, mental instability, marital instability, and also a decreased sex drive. So to avoid all of that, at Antai Hospital, we can offer you a more effective approach where you can avoid that destructive treatment and also achieve your goals. get in touch with us via the website, set up a consultation. Let's discuss how we can provide you this treatment so that we can have more women avoiding hysterectomy unnecessarily and also receive the treatment that they need without going for destructive ones like hysterectomy.